The Radio Misfits Podcast Network.
Hi, everyone, and welcome to episode 17 of Planted with Sara Pine. I'm Sara Pine, your host, and this week is Veterans Day. It's actually tomorrow. And today we have Eric Gopel from the Veterans Cannabis Coalition joining us. Eric, welcome. Thank you for being on today.
Thank you so much, Sarah. Looking forward to our conversation.
Yeah, well, we've got a lot of great stuff to cover. With this week being the week of Veterans Day, it's really important to talk about a lot of the great work that you and other veterans are doing to create access for people who need it. And one of the things I wanted to start out with so that our listeners understand why this is so important is talking about vets and PTSD. You want to talk a little bit about that? And actually, before we do that, let me go back a little bit more.
Sure.
Let's talk about your organization and why you started it.
Right. So the Veterans Cannabis Coalition, we're an independent advocacy group founded by myself and my co-founder, Bill Ferguson, in 2018. We're both Iraq war veterans. We had both spent a significant amount of time in D.C. working on policy and lobbying issues in a variety of different contexts, and we saw the real need for a persistent veteran advocate on cannabis-related issues, because we both personally understood the powerful impact, especially medical impact, of cannabis. We had seen that repeatedly in the lives of other veterans we had witnessed, or we know and have gotten to know over the course of our advocacy. And we've seen the sort of worst case scenario where veterans who were on cocktails of toxic and addictive pharmaceuticals, who had almost no real alternatives or alternative forms of treatment available to them, who over time basically succumb to what I would consider like pharmaceutical harms, right? A term that's often used in relation to seniors and how many medications they take. And I think you've dealt with senior patients too, right? Polypharmacy.
Yep.
Taking multiple medications at the same time, often taking medications to counteract the side effects of other medications, right?
Right.
And veterans and you mentioned PTSD a little bit before this, and this is probably a good way to segue right into it, right? Like PTSD is a very complex condition, right? There's physiological aspects to it, like hypervigilance and things that physical responses like sweating and things like that. And there's also tons of mental aspects to PTSD, like depression and insomnia and anxiety, right? Now, because PTSD is a condition that presents both physical and mental symptoms, and because we exist in a medical system that basically assigns one pill, per major symptom, veterans end up, being prescribed, 4, 5, 6, in some in the very severe cases, close to a dozen different medications to manage, these different symptoms that are arising from these complex and, oftentimes overlapping disorders and other conditions. Now, the end result of that is that there are a lot of, veterans end up, my co-founder, experienced this directly. It ends up sort of in this perpetual brain fog, or, having fits of uncontrollable rage, or, sexual dysfunction, or any number of other side effects that come with, heavy pharmaceutical use, on top of their existing, their already pre-existing conditions. And we wonder why veterans die at such high rates of suicide, and more importantly, why the rate of suicide has not changed in 15 years, despite billions of dollars in interventions and dozens of programs and reports and commissions and all sorts of other interventions designed specifically to prevent veteran suicide. None of them have made an impact. In fact, veteran suicide is up 6%. I mean, based off of the most recent data, which is always 2 or 3 years behind.
Right.
Because that's the kind of that's the government we have right now. And why is that? Well, it's like the one thing that the VA and private health and a lot of these interventions have never really taken into account is that pharmaceutical use.
Right.
Because it's just like it's like in the environment, and people will sort of obliquely recognize it, but and this is what I tell now, staff and members of Congress and really whoever else will listen to me, right? Which is, why are we surprised that veterans continue to die at such high rates of suicide when we regularly prescribe them drugs that are known to increase the risk of suicide, right?
Right.
And providing them no alternatives.
Yeah. And then when you think about just what a person goes through when I think about, like, in my family, my grandfather and my great uncle both were in World War II. And my uncle Vilho was with Patton from Africa all through to the concentration camps. When he came back, he disengaged from society. He came back a war hero, but he was never the same. And I just think about, when people go into self-medicating, whether they realize it or not, like my uncle, his response to that was having issues with alcoholism.
And that's generally it, right? Like, alcohol has been, if you want to go back to, talking about like PTSD and the veteran experience, a lot of times you'll see in like treatment literature references to like Odysseus, right? It's a Greek, classical Greek hero written by Homer, who spent years, Odysseus went off and fought a war, and then essentially spent these allegorical years sort of wandering and trying to return home, right? And in the sort of course of his experience, he evidenced so many of the symptoms of PTSD or moral injury, which often kind of get lumped together.
Yeah.
And even someone like your uncle who fought in a I can't think of a more just war, right, that the United States at least has been engaged in, than fighting Nazi Germany and Imperial Japan during World War II. And to think that people who were even people soldiers who were fighting the good fight, so to speak, right, to come home with that kind of trauma and to be, and the expectation is that sort of like, don't talk about it, right? Yeah. Like, and to know, especially as a World War II veteran, that 10 million other or 14 million other people served, not necessarily in the same battlefield that you did, but, a giant chunk of the United States population served in one way or another during that war.
It's true, and that's one of the things, my uncle and my grandfather never talked about the war. The only thing my uncle ever said was, well, what I learned later on, before he left, he was in love. And when he came back, he just couldn't believe what human beings could do to one another. And it really traumatized him for the rest of his life.
And that's, I mentioned moral injury, that's the moral injury part, right? Whereas like PTSD, if you look at the sort of literature around it, theoretically there's a triggering event, right, that puts you in fear of your life, or it's like essentially, you're put in fear of your life, you witness death or, something pretty heinous, and either witness it or fail to intervene, or, there's a variety of things, but usually there's some sort of trigger. Whereas, I can't imagine fighting, I'm not going to really try to relate World War II experience to Iraq, but the sort of doing multiple tours in places where we're nominally trying to help people, and then just seeing nothing, like, what progress are we making? Almost everyone that we worked with in any real capacity in Iraq is dead or a refugee. The lucky few have been able to come, get special immigrant visas and come to the United States. But what have we left for the people that we spent so long and theoretically thousands of American lives and literally trillions of dollars trying to I don't want to say fix, right? But that was sort of the perception that we were trying to fix Iraq. Mm-hmm. And where are we today? I have to imagine that that has to be very similar to Vietnam veterans, especially the Vietnam. People think Afghanistan is actually the longest war, but technically Vietnam started in 1955. So it ran from like 55 to 75, wow. 76. So anyway. Yeah. Because that's when U.S. involvement started, in the 50s, when Eisenhower started to send troops over because the French were getting their ass kicked by Ho Chi Minh, right? Mm-hmm. So, and of course, like the nature of that war shifted very substantially over time, right? And it escalated considerably, especially in later phases of the war. But to have served in any capacity during that time, or to have been involved in like the secret bombing of Laos and Cambodia, right? Which everyone knew was sort of illegal, and that's why we kept it secret or tried to keep it secret for as long as we could. What are the impacts on the people that are the people involved in actually executing U.S. policy in this way, right? I mean, they're lifelong. I mean, my grandfather, he served in Korea. He was a defense contractor, Sikorsky, which is a helicopter manufacturer, contractor in Southeast Asia, quote unquote. It's like I think he was in Cambodia or Laos, right? Like I remember, talking about like how no one talks about the war. I mean, so many of my family are veterans. I've almost heard nothing about their military experience from any one of them. That's just the reality of that. And my grandfather the same way. Both of my grandfathers served. One was a career naval, career sailor. The other was also a sailor. Did his time. They all had so much, pent up, just trauma related to those things, and and I don't know if they ever really felt comfortable talking to anyone about it. And they all internalized it in different ways and processed it in different ways and figured out other ways to manage it. I think most just sort of shut it off, right? Stuff it down and compartmentalize as best they can. But of course, it all comes out in periods of stress or, alcohol use or other drug use, right? Like when the guard starts to slip and now the memories start to come back. And because you've never been able to, deal with it in any real substantive way, you're just overwhelmed and you lash out or you self-harm or you do any number of things that aren't, that are like, it's all lose-lose, right? Like, and that's, that has been the veteran experience for a very long time. I'll pause there for a second.
No. That's all great stuff. I mean, very intense and sad, and it's something we have to talk about because and then when you look at like veterans from the Korean War and Vietnam are now becoming they're senior citizens, so there are other things that are compounded with all of this, and like you were saying, there's a lot of pharmaceuticals that can create a suicidal, a tendency for suicide. And then you also have, as people are getting older, with dementia, like when we talk about like there's a black box formulary of pharmaceuticals that they use to treat people with dementia, which one of the side effects, strangely enough, for people with dementia can be sudden unexplained death. And, we've actually
that's why Alzheimer's is one of the top killers, right?
Right.
In this country.
Yeah. And that's, when my grandmother had it, and I wished I would have been able to give her cannabis. Yeah. Because there's so much that it does to help with that too,
Yeah. So, I mean, so all my grandparents had passed. Both my maternal grandfather, he was the career sailor. He passed before I was born, right? He was a coal miner, went off in the Navy for 20 years, came back with a family, and then kind of returned to the mines, and he smoked and he drank. My grandfather died of heart disease. I mean, relatively, within the age of, I guess, life expectancy range. So I don't think it was particularly unexpected, but my grandmother dealt with Alzheimer's for years, and both my mother and my stepfather died from alcohol-related complications. And they were both veterans as well. My stepfather being a combat veteran from Vietnam, and my mother being she served during the Vietnam era, but I think she was a signal corps analyst at that time. Wow. Radio communication stuff back in the day, right? Very primitive, I'm sure, compared to what anything we're dealing with now. But like at the time, of course, got an edge. And it's like that's been my family experience, is sort of knowing that and kind of seeing the sort of long-term effects of just never really been able to find something that works for you that doesn't come with just severe side effects, whether, or complications, right? Like alcohol, I guess, people have successfully self-medicated with alcohol for successful. I mean, might be kind of a relative term there, but, stable on alcohol, I guess,
right,
for years, potentially.
Right.
Until they're not, right? Until the hepatitis or cirrhosis or something else comes into play, or a DUI, and then all of a sudden, right? Like it's no longer working for them, and in fact, it's now turned pretty considerably against them, and that is not the case with cannabis.
Right.
And, to your if I could offer my grandmother or my mother, my stepfather, any of the people I've known who would have benefited, who have passed, would have benefited from it, I would have. And that's a big part of what drives a lot of my advocacy, is sort of this knowledge of how many people in my life, personally or secondhand, have passed and suffered, I think, unnecessarily because of prohibition.
Right. And so when we're trying to smooth that road for access for people, what are some of the things that you're coming across? I'm imagining that you've had a lot of roadblocks on the federal level.
Right. Yeah. We initially got started trying to move a cannabis research bill through the House, and we were initially pretty successful in 2018 when we got started. The VA Medicinal Cannabis Research Act 2018 became the first cannabis-related bill of any kind, to our knowledge, ever advanced out of congressional committee, and that was the House Veterans Affairs Committee under Republican leadership, which is even more surprising. And so, us being not cynical enough, apparently, thought that we actually had a shot of, at a VA cannabis research maybe being the first kind of like chip in the wall of prohibition, right? Because we knew that it wasn't going to substantially change people's veteran access to cannabis or anything else, but at least it was going to lay the groundwork for future reform, as well as undermine the government position that cannabis has no medical value, right? We all understand that it does. The federal government admits that it does, at least that admits that the individual constituents of cannabis have medical value, even if somehow the entire plant together does not. But that bill failed. It failed because the Republican leadership at the time didn't want to take it up. And unfortunately, we've seen essentially the same issue with under Democratic leadership. The bill, it was delayed for a year, passed out of committee right before COVID in March. But will it ever be included in any packages or pass as standalone legislation? Well, it still hasn't. So my expectation is that it won't. And that's purely a reflection of political will.
Right.
We've seen, but on a good note, right? Veterans Cannabis Coalition is part of the National Marijuana Justice Coalition, which includes the ACLU and NORML, Drug Policy Alliance, and 12 other nonprofit or 11 other nonprofits and advocacy organizations, and collectively we're all advocating on behalf of the MORE Act, the Marijuana Opportunity Reinvestment and Expungement Act, which deschedules cannabis, which effectively decriminalizes, because just to explain to folks who might not know the difference, rescheduling cannabis would just mean changing it from a Schedule I substance, which is defined as having no medicinal value and a high potential for abuse, to a lower schedule. But it still retains the criminal penalties for possessing a controlled substance without proper medical documentation, essentially. Whereas descheduling, removing cannabis entirely from the Controlled Substances Act, it's a plant and shouldn't be on there in the first place, that basically effectively decriminalizes at the federal level, meaning that it's no longer a controlled substance. So that means possession, cultivation, manufacturing, transportation, all of the other crimes, quote unquote, that are associated with using or having cannabis are removed, right? But the critical point there is that it does not create the enabling legislation to then federally legalize cannabis. That's the big thing that people might not quite grasp, is that descheduling does not mean that the federal government now allows for import-export, or that interstate commerce is possible, or any of that, right? It simply just removes cannabis from the Controlled Substances Act, and then creates the circumstances where Congress can then pass further legislation to answer those questions. Because in the meanwhile, between descheduling and full legalization, the states are basically at their own devices. So California, cannabis tax and regulation laws are not going to change under federal descheduling. It would only be under some future and currently unproposed tax and regulation scheme, which no one's really at that point yet, even advocates. Mainly because every state has kind of taken their own approach to legalizing, taxing, and regulating cannabis, and for the most part, advocates are like myself are inclined just to kind of let that play its course and kind of let people catch up, more or less, before we start to push for sort of uniform regulation of cannabis. And more importantly, I'm not really a fan of a lot of federal intervention in cannabis in general, because it's a plant. So it's like I don't really, so beyond commercializing it and licensing in that way, I really think that individual rights to use and associate with others who use and for non-commercial purposes shouldn't be infringed whatsoever. So, but that's all sort of in the wind currently. But the MORE Act is going to be coming up for, today is November 10th, tomorrow is Veterans Day. The MORE Act should be coming up for a vote either the first or second week of December. So that will be the first opportunity that any Congress is going to have to vote on a cannabis descheduling bill, which, again, not legalization, but the first step, or a large step to, or effectively it doesn't legalize it, but it does end cannabis prohibition as we know it, right?
Right.
Because it'll no longer be treated in that way legally.
Well, okay. So when you and I met, we were doing a veterans a cable show, and we were talking about cannabis, and we had somebody from the VA on there. And it's been a little bit of time, so I'm imagining there may have been some changes. What? Yeah.
If only, right?
I know. I see. It seems like there's a little bit more of a don't ask, don't tell policy with certain parts of the VA than there was before.
It's a very mixed bag, right? The VA is 50,000 employees, over 1,100 clinics and hospitals and all this admin and everything else, right? They operate in all 50 states. It's the largest unified medical system in the country, the VA, serving over 6 million veteran patients. So it's a big ship, right? And it doesn't, and because it's so fragmented, not every piece basically acts the same way. So if you're a veteran and sort of from the top, the VA is not supposed to penalize veterans. It's supposed to encourage doctors to talk to veterans about their cannabis use, and it's not supposed to, essentially it shouldn't be used against you. Of course, that's not actually the case. We've heard from some veterans who've talked to their doctors, especially veterans who might be prescribed Schedule II substances, stuff like Adderall, right? Because they're, veterans are often given sedatives and then have a hard time staying awake. So, they give you a sedative to put you asleep, and then they give you a stimulant to keep you up. But in reality, it's like you're just speedballing, right?
Mm-hmm.
I mean, you're taking amphetamine, Adderall's amphetamine, and then you're taking something like Ambien or, a benzodiazepine, Valium or Xanax, to get to sleep. So, I mean, and that goes back into the pharmacological harm and everything else. But, what we're looking at here, with the VA, I think it's an institution that has the capacity to change, but it needs to be compelled to do so, right? Individual VA doctors might be very open to talking about cannabis use with veteran patients, but they're still restricted because of the legal, the laws that they have to operate under. They're federal employees, right? They can't recommend, even at the state level, patients to use a federally controlled substance. That is the big contention between the VA and some advocates basically asking the VA to get involved in this. The reality is the EPA's number one fallback is that as long as it's a scheduled substance, we really can't do anything with it. Even if that's not true, it has become very, very tough to get the VA to move, which is why the VA Medicinal Cannabis Research Act over the last couple of years was going to be like our attempt to get them to do that. Now, we've since sort of, gone back to the drawing board a little bit with, how maybe the VA needs to be best approached. And right now, what we're looking at is working with some other medical professionals who are aligned in the cannabis advocacy space to propose a new legislation that would create some sort of continuing medical education about cannabis within the VA healthcare system. Because right now there's no official content the VA produces telling doctors anything about cannabis, even though obviously you're an advocate, the medical side of this stuff. I mean, it's one of the most important neurotransmitter systems in your body, the endocannabinoid system, and most doctors have no clue how it functions or how phytocannabinoids like THC and CBD found in the cannabis plant interact with those, right?
Yeah.
And it's like not understanding like the endocrine or like the lymphatic system, and it's just like, how are you really a doctor? CB1 and CB2 receptors are literally located throughout, throughout your entire body. They seem to influence, just a whole list of, physiological processes. And like, we're just content with just ignoring it and not trying to investigate it to its fullest extent and figuring out like how it can best serve us. Like that, to me, that's just completely antithetical to being a doctor or being a scientist or, but I'm not either of those things, so maybe I'm missing something.
Well, it's true. That's why I do, as an educator, I actually do a lot of lecturing at healthcare institutions like UCSF and Kaiser,
right?
Because they don't understand it. And even working with pharmacology students and explaining to them, how it works and how to find dosage, because even in the industry itself, there's a lot of haziness, like when there's suggested dosage on boxes, and what we really should be doing is having the conversation about how everybody reacts differently and how do we create this, safe container for exploration with, the way that the cannabinoids and terpenes work. We base our education on a broad generalization about how the majority of human beings respond to it. But then let's set up, the foundation for successful experimentation with it as well. I also think that, because I have a lot of veterans that I work with, and, I look at them and I think, what would it have been like if after they had, after when they were recovering, that they were actually able to have like a CBD regimen or something that's restorative to help, right after the fact? What would that do?
I'll just put this out. I'll just put this out in the air in the hopes that someone puts it, takes it up. But like, if I was to design a clinical trial, like the first clinical trial I would do with a cannabinoid would be to put CBD up against ibuprofen or any other NSAID, non-steroidal anti-inflammatory drug. The NSAIDs, especially like ibuprofen and Advil, Tylenol, these have become like the crutch of the healthcare system for treating inflammation and essentially pain that doesn't rise to the level of being prescribed an opioid, right?
Yeah.
But what the results of this stuff. I was at one point, I had while I was still in the military, they call them like Ranger candy, these 800 milligram tabs of ibuprofen. And we were told to take 4 of those things a day.
Wow.
3,200 milligrams of ibuprofen a day. And I know I was taking more. I was probably taking close to like 4,000, or over 4,000 milligrams a day, right? Because I had, because I was in a position where I was I couldn't really get real medical care, or not the kind that I can't stop doing my job.
Yeah.
I'm in pain. How am I going to get through this, right? And there's so many people in the military that basically adopt that mindset because you're forced to, and they carry that outward with them, right? Which is like, I don't have any help, so how am I going to get through this? And this is where, not just the education part, which is essential and huge to any kind of advocacy around cannabis, but just creating community around it as well. Because, what you pointed out, it doesn't, like, we kind of have a general sense of how people will generally react to THC or CBD, but we know, or any of the other cannabinoids, but we also understand that, because we know these people too, that, some people cannot tolerate THC or, because they have severe anxiety when they take it, or, I guess I'm sure there's in some cases where CBD is not well tolerated by people, right? Because maybe they have some liver issue.
Absolutely.
So,
well, I mean, with CBD, what it is, a lot of times it can give people the blues if they're sensitive to it, or
right.
instead of how, it kind of creates balance for some people. For some people, it can elevate them to the point where they actually feel like slightly agitated. It's a small group of people, but it's much more than we thought it was before. And as more people start to use it, we'll start to, see these interesting reactions, which a lot of them have to do with our neurodiversity as well. And that's one of the things that we don't take into consideration is like our brain chemistry has so much to do with how we metabolize cannabinoids as well.
Well, and think about, we'll just stick to veterans, right? The brain chemistry of a veteran can change and probably has changed, right? Especially for veterans who have experienced traumatic brain injuries, right? Yeah. Their brain no longer functions like it used to, and more than likely it has some sort of disordered function. It's no longer working there's no longer in homeostasis.
Yep. So,
and the normal course of treatment for something like that would be drugs and surgery. Maybe not even surgery, but you get stuff like, and if it works for you, and I'm happy that this is an option. But I don't know if you're familiar with stellate ganglion blocks. I was just kind of brushing up on that today. That's one of these proposed treatments for PTSD. They propose all these exotic and invasive therapies, and and they still ignore cannabis, which is one of the supremely frustrating things about what I do. But this is essentially injecting an anesthetic into the base of your brain, into the stellate ganglion.
Yeah.
But I think what is it called? It calms the limbic nerve or something along those lines. And there's a part of PTSD is basically getting caught into a continuous fight or flight response, right? And that's a physiological response to what could have been, an external event, but and driven essentially by just witness trauma, right? Not necessarily a brain injury, but you have what can be, I don't know if it can be considered like a brain injury, in that the physical parts of your brain are now functioning differently than they used to.
Absolutely.
And in the sense that and they found okay, you put you inject anesthesia into this one ganglion, and then all of a sudden it calms that response, and now people with PTSD aren't locked into that fight or flight. But let's be honest, right? Okay, you're injecting an anesthetic into somebody's fucking brain, into somebody's spinal cord.
It's okay. We're on Radio Misfits Network. You can swear.
Yeah. I curse pretty regularly, but yeah, I try to clean it up generally. But, some of this stuff is ridiculous, right? It's this is just an example of the lengths we'll go to do anything but look at cannabis.
Right. Right. Or just in general, having things that are natural, that can't necessarily be patented. Yeah. Well,
yeah.
I would love to see a clinical trial on, soldiers who have undergone trauma and right after they get treatment with CBD, to see what that does, especially with what the incidences of CPTSD are after the fact, if you've had some sort of restorative treatment on the spot, when they're off the field and they're coming back. Yeah, because I think that.
Well, and that's. Sorry.
Oh, I was just going to say, one of the things that what am I saying? I'm preaching to the choir when I say this, is that, where is the restorative practices to support people who have been through that kind of trauma?
And restorative, right? Pound of prevention is worth, or ounce of prevention worth a pound of cure. And, if we understand that people in military service or any other job or occupation or circumstance let's just stick to brain injuries for a second, that might experience a brain injury, whether it's a mild, non-penetrating or acute, or like, basically getting blown up in Iraq, or just getting your noggin knocked by a blast wave from a heavy weapon, right? They both produce, these kind of, these physical forces that damage your brain. The sort of chronic exposure, what we found is that a lot of people who served in the military who were in positions where they were, using explosives or firing heavy weapons or otherwise exposed to chronic low-level blast waves, end up developing what is initially diagnosed as PTSD, but ends up being revealed to be a brain injury, in that the white matter in their brain has basically been rattled apart by constant exposure to these blast events, right? But these blast events never raise the level of producing like an acute harm, right? They might be a little like lightheaded or maybe a little nauseous after it, but it's not like their ears are bleeding or anything, right? Mm-hmm. So they just go on with their day, and then years of that, and then all of a sudden at the end, at their end of this, or then they're getting medically discharged because their memory is shot, or they lose their ability to emotionally regulate, right? And they're wondering like why, how,
Right.
Now, if you were to develop a protocol, I mean, I'm pretty anti-war at this point, but let's just say the military doesn't disappear tomorrow, and you wanted to protect the people that we're training at least, and that these blast exposure is a thing that happens. I want to say the Israeli military has experimented with CBD nasal sprays as a prophylactic or as like an immediate therapeutic for people who have been exposed to blast events, right? Because hey, CBD, along with the other non-psychoactive cannabinoids, patented as neuroprotectants and antioxidants by the Department of Health and Human Services back in 2003, ancient times.
Right.
Like, so we understand that these things have those effects. The fact that we continue to not use them or implement them in any real way is really just a reflection of our lack of political will, and I'm sure an ocean's worth of misunderstanding or lack of understanding about the efficacy of cannabinoids and cannabis medicine in general, right? Like that's still a huge thing we've got to overcome. Because I think, a lot of elected leaders are still thinking this is just like, this is just going to be how we're going to balance our budgets.
Yeah.
No.
Yeah. Well, and
no,
speaking
you are really missing the forest, Trace. Yeah.
they miss the message continuously.
Yeah.
But speaking about taxes, so for those who have found cannabis and are using it regularly to alleviate, their discomfort, symptom management, however they're using it, I mean, we are looking at a time where governments are looking at cannabis as the ultimate bailout for all of their economic woes, which we know is not realistic. It's a business like any other. But because of this, we're seeing exorbitantly high prices on cannabis. And when legalization occurred, all of our compassion programs dried up. And so with the collective efforts of people like you, me, our colleagues in the greater cannabis community, people like Joe Roney, Weed for Warriors, we were able to pass SB 34. And those guys are so awesome. It was amazing how
I'm
came together.
Yeah. No, I mean, and I've really taken a page from, the NorCal Bay Area book when it comes to trying to realize compassion programs. Because, I'm based in Southern California in the Long Beach area, and, there's nothing. There's really nothing down here, and historically there has been nothing. I think the closest, based on some research I did, might have been like West Hollywood, right, where they were operating a compassionate, dispensary essentially specifically for, AIDS and cancer patients and other, terminally or severely ill people, right? But that got shut down by George W. Bush's DEA back in 2001. I'm not really aware of any other really significant efforts to kind of make cannabis available to patients on a compassionate basis. That has kind of been where we started from. We've with SB 34 though, that now creates the pathway that we're trying to now bring cannabis, people who are nominally cannabis allies, right? People who at least talk the talk about, caring about patients and not being the understanding that this is more than just about, the bottom line. And I'll be honest, anyone who thinks that you're going to, as a business operator, to think that you're going to be able to be successful long term and not be able to, and not service patients, in this sort of time before cannabis becomes like a fully regulated, FDA approved, in whatever circumstance that cannabis is sort of available, I imagine it will be available in many forms, but patients are going to be the number one consumers, always.
Right. Always.
Right? Because they have to, because it's literally something they can't go without.
Right.
So to try to, and I don't even think the industry is really capturing most of the patient population right now because, as you mentioned, the taxes are way too high. I mean, you're paying, it's a 15% excise tax right off the top. Then you're talking your local sales tax. Then you're talking, whatever county or other locality taxes might be put into place on top of that. So you could end up paying 35% on top of whatever is already a pretty expensive product. And then, in your $35 eighth is now $50.
Right.
and all of a sudden it's like, okay, well, now I have to make a lot. Now I have to start making hard decisions about whether I'm going to be either even buying legal cannabis or just buying cannabis at all, especially in times in what we're experiencing right now. Enhanced unemployment has ended. A lot of people are in very tough financial straits. And I know, especially among veterans who have the option of going back to pharmaceuticals, a lot of them are, because as bad as they are, sometimes having nothing is worse. And
yeah, because that's
and it's a fucking it's a real shame.
Oh, it is. It's horrible. I was just emailing with somebody who was on my program before, my cannabis compassion program, who's he was a Vietnam vet, and he's at home dying. And it's like, how do you? These people need our help, and one of the things, SB 34 passing is great, but a lot of people have been really confused as to how to go about giving or why they should, or wondering like where they'd get donations. So one of the things that I've been working on with a team of colleagues is creating best practices and putting together something that people can look at so they realize that it's not as difficult as you might think. And that it can be really impactful, because we only have a few programs in California and we have so many people who need help. So we need to do what we can to encourage people to start doing these. And I'll have to say, like, when I started my program back up in October, and I was just overwhelmed by the generosity of the companies for donating, because I was really nervous. I mean, prior to COVID, we were looking at major extinction events in our industry. So, you want to be able to serve the people in need, but you also are cognizant of the fact that a lot of these companies were in distress too, but people really, really pitch in to help. And I just think that, we just need to let people know that it is possible to do this. It's not as hard as you think. It's, I know metric's scary, but it actually supports this now.
Yes, exactly.
Metric is everyone's nightmare. But we do, like, and it's crazy how, we can't forget the people that the reason that we have access to cannabis now is because of these people who are sick.
Exactly. It was cancer and AIDS patients, right,
Yep.
who basically paved the way to commercialization of cannabis in the state and across the country.
Yep.
I mean, in San Francisco, right? Gay Vietnam veteran hippie Dennis Barone, Brownie Mary Rathbun, a lot of other, and also, I mean, obviously there were advocates that joined in the Prop 215 battle for SoCal too. But it has been predominantly, Bay Area folks. And I've kind of developed my own theory as to why there's just been better compassion in the Bay. And I want to say it's just because you have so much better access or close access to outdoor. Yeah. Whereas basically in Southern California, everything has been grown for indoor. and for sale, it's a lot more expensive to grow indoor. It's less feasible for some of these operators, even if they were inclined to do so, to give away free product, even if it's stuff like trim. Whereas up in the Emerald Triangle, in the Bay Area, being right at the 100 miles south of that, and a lot of farmers who basically, who really, I guess, lived that sort of ethos that this is something to be shared, right? And this is something that everyone should have access to. And I'll grow and I'll make my money, but I'll give 10, 15, 100 pounds away to people who need it, just because, right? That's just it's like giving back to the earth in a way.
Yeah.
Trying to get that ethos back into the cannabis industry, I think, is what's going to save it, to be honest. I don't think that it's ever going to be able to get the kind of tax relief it wants in any kind of near term without allying directly with patients, because the industry doesn't have the people numbers to really turn out any kind of movement to help them, right? They have to rely on paid lobbyists. Who's going to come to bat for some of these businesses if, for whatever reason, the state or locality started to go after them for any reason?
Yeah,
right?
I definitely.
Who are your allies?
Yeah, I think that it's still very much a grassroots thing, because when you look at when we passed Prop 64 and California allowed adult use cannabis, people were saying to me, basically, because I was, back for the 215 days, kind of like, girl, you're obsolete.
Right.
Medical's no more. We don't need that. And I was like, well, whether we're calling it medical or recreational or adult use or what have you, it's still a substance that creates a reaction in the body. And I really don't think it's going to be a bunch of stoners that haven't had access to cannabis before busting down my doors. And I was right, because what we're really looking at were people who didn't want to have conversations with their doctors about getting recommendations, but were curious about what cannabis could do to help them. So we have people who come in and, they're curious and they really just want to know what it's like to get high. And there's nothing wrong with that either. I'm not creating any stigma around that. But what we're getting more of are people that are saying, I'm having problems sleeping, or I'm anxious, or, hey, do you think if I took this after I worked out, it would help my muscles bounce back faster? Like lots of questions like that more so. And even though they don't have cards, they're still looking at using it in a way that's more about creating balance.
Well, I look at it just like, it's you're right. This is a plant. It has compounds, chemicals. These chemicals have effects on your body. We understand some of the effects at least, and some of how these things, how THC interacts with your receptors, and, what kind of systemic change it creates in your body, and all the different processes it influences, right? And then how does CBD do that? And how do these things do that in combination? And how do they, and that's where I truly believe that there's a cannabinoid for everybody, right? Mm-hmm. There's nothing that anyone is taking either as a medicine or consuming as a food, I don't think, that could be either replaced or enhanced with some cannabinoid. Or, if you just want to step back a little bit and just say, hemp seed, even as a, just as a plant product. And that's the potential of this plant. It's so vast.
It is.
And sometimes it kind of makes me feel like, I'm like, oh man, it can do, like, it kind of feel like Jack Herrar was right? Like, the emperor has no clothes. Hemp and cannabis have the potential to, disrupt literally trillions of dollars in U.S. Commercial activity in terms of, influencing everything from obviously the production of medicine, right, across. What disease state or condition or illness, could a cannabinoid not impact? Mm-hmm. I don't know. Probably all of them, right? Once we really start to, go down this ladder and really figure out, what everything's doing and how we can get them, and more importantly, how we can, produce them at scale. Because a lot of these, THC and CBD are cheap, right? But the other stuff, CBG or, THCV or, these other sort of minor cannabinoids that you don't really see in great concentration in the plant, it might not make sense necessarily to grow a ton of biomass just to extract a little bit of these things, especially if these like minor cannabinoids end up being, I don't think that they're going to like suddenly replace THC. I really think that's the workhorse of a lot of the medical effects that people get from cannabis. But I'm willing to admit that I don't know. Obviously, I don't know anything. Really, when it comes to cannabinoids, I mean, beyond what we're just scratching the surface of.
Well,
so could there be, like that sort of like miracle cannabinoid? Maybe, but I'm probably more, more likely it's going to be figuring out these formulations, right?
Sure.
And trying to tailor, this ratio of CBD THC or this, the presence of CBG, might enhance, this particular, effect that you're looking. And, and that's, I mean, look at what you're doing, right? Like, I think you're standing at the future of this sort of personalized medicine, which is going to be made possible with cannabis. And what I'm hoping to be sort of the follow-on plant and fungi medicines that are going to hopefully be scheduled within the next, a decade or less afterwards.
Well, there's a lot of synergy between it all, and that's
why
the
not,
thing,
right?
Yeah, and I think,
and why not put it back in the hands of individuals, rather than just gatekeep it all behind, and obviously I really don't like demonizing pharmaceuticals as a rule because they exist, they have certain effects. Some people really benefit from those, right?
Mm-hmm.
I don't think that a lot of pharmaceutical use and prescription is appropriate, though, especially when we know that there are lower risk alternatives available if we, just put our shit together to make those available. So
there's a time and a place for it. There's a time and a place for it, and I really feel like, especially when I would still be in the dispensary more often, and I'd have people who would be frustrated about availability or prices or taxation. One of the things that I mentioned is that, let your voice be heard. You pay taxes, you use cannabis, you're a functional member of society, and you vote. And this past election really showed the people are speaking. They're supporting cannabis, and the more they do, the more there's normalization, and the more politicians and policymakers are going to feel the pressure to actually learn something and hopefully make some good policy, because that's one of the biggest things for me lately has been talking about the fact that education drives good policy. And it's not just about educating politicians, because honestly, they don't give a shit unless the people, their constituents, give a shit. And their constituents care when they're educated.
Yeah.
Yeah.
Well, I mean, and I like to stay pragmatic when it comes to how we talk about creating the political solutions we need to make all these things possible, right? Because the only thing that's standing in our way for any of this stuff, making cannabis normalized as a medicine, fully investigating its potential and making that available to people, right? All that is just political will. Now, you can manufacture political will. Obviously, people are already overwhelmingly in favor of cannabis. Shout out to South Dakota, New Jersey, Montana, and Arizona. Arizona, Montana, and South Dakota, not particularly liberal states, right? Obviously New Jersey has been pretty blue for a long time. The fact that, and more importantly, the fact that South Dakota went from complete criminalization to adult use, I think really needs to be pointed out.
Oh, totally.
They skipped that middle. They've actually passed both initiatives. So there is going to be a medical program that's created, but they're also going to have adult use right beside that.
Yeah, that's the first time I've seen that. That
is the first time it's happened. Yeah.
Yeah, and it's. I mean, that's the thing. It's not a liberal thing. It's not a conservative thing. A couple years ago, I actually met with Michael Steele, and he's totally into, former head of the RNC, hilarious guy.
Look at John Boehner.
Yeah.
Sitting on the board of multi-state operator cannabis companies and things like that, right? These, I mean, and I don't, and to some extent, I don't really care how you get there.
Nope.
I don't care if you think this is going to be, your moneymaker, or if you see the overwhelming, just moral and ethical, imperative to change all this. I mean, to me, that's it, right? And that's what keeps me on this and sort of keeps me keeps me going is that it is such an injustice. And, of course, it's tied into a million other injustices, but it is one of the biggest manifestations, I think, of injustice we can point to right now in our society and say that, right? If we could change that, we can help millions of patients. We can, decriminal, put, thousands of people out of jail and prevent hundreds of thousands of people from ever, millions of people from ever seeing the inside of a jail or even being arrested ever.
Right.
Like the potential. And it's just, and to understand as a policy person, just sort of like what the pin you got to pull that just brings it all crumbling down is just this one thing. It's the scheduling of cannabis, right? That's what's holding this all together. And it's such a weak pin in the grand scheme of things. It can happen administratively, right? The president, Joe Biden, day one could deschedule cannabis. Is he going to do it? No, but he could. And the fact remains that, we talked about South Dakota, we talked about changing politicians' minds and the education thing. The number four man in the Senate on the Republican majority, John Thune, senior senator from South Dakota. That guy is super anti-cannabis. He now finds himself as one of the few Republicans representing an adult use state, right? Is that going to change his tune immediately? Probably not. But this also gives an opportunity for people who are willing to spend money in this kind of realm. And, going back to pragmatism, I think there's really three things that move politicians: masses of people, media coverage, attention, focus, and money.
The 3 M's.
Right? The 3 M's, right? And politics is transactional by nature. It always has been. To kind of think of it in other terms, I think, is to do yourself a disservice. So realize that you're always going to have a handful of these champions that are going to do your stuff, carry your issue no matter what. We've got that. Earl Blumenauer, Barbara Lee, right? And Barbara Lee, maybe going to be, fingers crossed, if Gavin Newsom is going to do anything good here, make her senator, right? I'd love to have Barbara Lee in the Senate.
Oh, Barbara Lee speaks for me.
But Berkeley, Oakland. She reps some of the districts that have made the biggest contributions to cannabis legalization in this country.
Yep.
Right. So, versus Nancy Pelosi, who also reps one of those districts, and yet not anti-cannabis by any means, but certainly not a champion. But going back to John Thune, is John Thune going to be a champion? No. But when we get to legalization in 2 or 4 or 6 years or however long it takes, right? And John Thune's probably still going to be in the Senate because it's South Dakota. These are seats that people hold on to for a long time.
Right.
We're going to now have some leverage on him. And unless they get rid of the filibuster, we're going to need 60 votes, right? Which means unless the Democrats really do a better job of messaging and putting up good candidates, means that we're going to need Republicans. It means you're going to come up with like 9 to 11 Republicans right now. That's a tough one, right?
Right.
But it's not impossible. And as states, and honestly, the states kind of make all federal change possible. And eventually we'll just get it to a tipping point where, once 3/5 of the states have gone adult use, if Congress hasn't moved by then, I think you've got very strong grounds to introduce a constitutional amendment, right? If you can get 3/5 of the states to essentially agree to ratify or create some sort of like interstate compact, similar to what's kind of happening with like electoral votes and other ways. But anyway, there's a lot of ways that sort of the tail can wag the dog here.
Mm-hmm.
I'm not sure. I guess or I guess the dog wags the tail. We're the country is the dog, right? That's the body. The tail is Congress, right? Yeah. And right now, I don't know. We just got to wag harder, because eventually, these other M's are going to come along with it, but until those are really brought to bear in a significant and I think sustained way, Congress is going to be able to keep kicking the can down the road. Because just look at what they're going to be dealing with over the next session. COVID relief, I don't know, green jobs, healthcare, right? That stuff just takes. That's it, right? Good luck on trying to get significant legislation introduced and passed when all the energy is basically being focused into these other areas. It is very difficult. That has basically been one of the biggest issues that cannabis has dealt with as a issue in general, is just that there's so many other priorities. So how do we need to make cannabis a voter priority, or at least an electoral priority, and that's not going to happen necessarily from either of the parties. Democrats are the most positioned to embrace cannabis, still refuse to do so. Mind-boggling every time that another cycle goes by and they see, oh, great, now look at, like, again, South Dakota, Montana. It's like Arizona just, went blue for the first time in like 25, 30 years, right? And it also just legalized adult use. Like, what, read the room.
It's true. Well,
get on it.
I think there's no way that it can be denied, that it's happening, and that more and more people are getting interested. And even when people live in states where there isn't cannabis, when they're visiting other states, like, we get a lot of people from in the time that when we don't have COVID, although tourism is actually people are starting to visit places again.
Interesting.
Yeah, I know. We get, a lot of people are curious and want to check it out. And I just really, I just want to thank you for, what you're doing and, what your other veteran colleagues are doing to help people, because it's, we need to honor and support our vets, and also this work furthers it for everybody else as well. We have a lot of work to do, even,
Thank you for saying that.
Yeah.
Yeah.
Absolutely. And I really look forward to, collaborating on future things. So you just let me know if you ever need my help. And also for our listeners who are interested in learning more about your organization and what you do, how can they get a hold of you on social media or follow you?
Oh, yeah. So first, let me just say your point that, like, what we're trying to do in the focus on veterans, I really try to broaden it out, right? Mm-hmm. Veterans are part of a community. If anything, I think we're excellent messengers, but we obviously can't do it alone.
Right. No, you can't.
So, yeah. So, I mean, we need the support, but this is my second service. This is my partner, and I know a lot of other veterans. Shout outs again to Ryan Miller in Operation EVAC, and Sean Kieran and Mark Carrillo at Weed for Warriors Project. Joe Arion at Wheatleaf Collective.
So hard.
Yeah, and they're right. I mean, and they planted the flag for veterans and patients, right? Like, our focus is currently on veterans, but the more support that becomes available, I really see this as an all patient, all community type effort, right? And the more people we get get to buy into this, the more likely we are to succeed in our sort of long-term goals and normalizing and making this available to everyone. So yes, that all being said, the ways that you can follow us or learn more about us, we're at www.veteranscanna, coalition.org. That is also our handle on Instagram and Facebook, Veterans Canna Coalition. And if you have, we currently have a call to action on the MORE Act. So if you have any interest in contacting a member of Congress and sending them a message about why they should support the MORE Act, particularly as it relates to veterans, you can text VCC, that's Victor Charlie Charlie, to 52886, and you'll receive a link. Click on the link. Enter your zip code and address, and basically it will direct you to your member of Congress, so you can then send a message in support of this bill, which would, again, deschedule, decriminalize, and importantly, fund the restorative justice programs like expungement and social equity.
Eric, a pleasure always. We always have stimulating conversation when we get down on policy and everything.
Yeah, we got to talk more.
Yeah. Oh, yeah. We definitely will talk more. And I'd love to have you on again, too, especially when there are new things that you're working on. So everybody, Eric Gopel from the the Veterans Cannabis Coalition. Thank you so much. If you'd like to follow Planted, we have social media and website links. On Instagram, we're Planted with Sara. We are also Planted with Sara on Facebook. Also, www.plantedwithsara.com. And of course, you can find us on Radio Misfits Network, Amazon, Pandora, Spotify, Stitcher, Google, and Apple Podcasts. So stay tuned this month. Like I mentioned last month, we are going to 2 episodes a month. Really exciting coming into the new year with So many great guests. So please, everybody, stay in touch, stay safe, and be good to each other out there. It's a crazy world. Take care.